Good morning, how are you?
Good, how are you?
Good. My name's Mackenzie. I'll be the nurse taking care of you this morning. I just wanted to provide a little bit of education on the new medication you were given this morning for your Parkinson's disease.
Okay.
So I do have this handout for you. It has all the information that we'll be discussing on it, so you can refer back to it afterwards, okay?
Okay.
So the medication that you were given is called levodopa carbidopa. It's also known as Sinemet. And the goal of this medication is to treat and lessen the symptoms that you're having with your Parkinson's disease. So the tremors, the muscle rigidity, and the lack of balance. And the way that this medication works, so with Parkinson's disease, you're missing something called dopamine within your body. It's a chemical. It helps regulate a lot of things within our body, and one of those things is our muscle strength, our ability to use our muscles. And so this medication is used to replace that dopamine so that you can regain that muscle movement, okay? So it's typically prescribed as a pill that you will take with water. You can take it with or without food. That's totally up to you. Just know that if you do take it with food, make sure that the food is low in protein. Protein can affect the way the medication is absorbed within the body.
Okay.
And then I do want you to be aware that it does take a little while for the medication to kind of kick in and for you to see the effects of it. They say about 6 months. So for the first 6 months, don't get discouraged if you don't completely see a difference with the medication.
Okay.
A few other things that I do want you to be aware of with this medication, there are some adverse effects. One of those is called orthostatic hypotension. It happens when you stand up too quick and your blood pressure drops really fast. So it can cause dizziness, it can cause you to fall. And so we just really want to prevent any falls and any injury for you. So if you do feel dizzy when you stand up, we want you to just sit back down until you don't feel dizzy. And just try and stand up slowly, especially when you're laying down. Maybe sit up for a couple of minutes before you stand up completely. And just before you start walking, make sure that you aren't dizzy. And so that way you can prevent falling. Another thing that we want you to be aware of, this isn't necessarily something that you need to call the physician about, but it will change the color of your urine and your sweat. It'll make it darker. So we don't want you to be alarmed when that happens. Just know that that typically happens with this medication, okay?
Okay.
A few other things, it can cause your tremors and your involuntary movements that you have to be increased. So that's an adverse effect. So if that does happen, we want you to call your doctor, okay? And he'll either change the dosage or change your medication, because that's not something that we want for you.
Okay.
And then a few other things just to be aware of, it can cause nausea and vomiting, and it can also cause hallucinations. So if you experience any of these, call your physician.
Okay.
Do you have any questions about any of this?
No.
Okay. Well, like I said, I have this handout for you, so you can refer back to that. It's a lot of information to take in at once. And you can always call our office if you have any questions or concerns regarding this medication, okay?
Okay. Thank you.
Thanks for your time.